My name is Dr. Jacqueline Kitulu. I am a general practitioner. I'm in private practice. But besides that, I am chair of the board at WomenLift Health Uganda. I also sit on several other boards. I sit on the board of PATH Kenya, E+ Kenya. I also most recently sit on the board of Farm Access, and I'm a immediate past board member of the Kenya Medical Practitioners and Dentists Council. I belong to the inaugural East Africa cohort 2022. The influence of WomenLift on institutions and the places that I now sit. For me, I think the most important thing is busting that myth that women leadership is just leadership like any other. And that understanding that for women to lead, there has to be an intentionality in ensuring that women can bring the great assets they carry in diversity, in inclusivity, the very many vast assets that they bring to the table. One has to be intentional about that. And many ways in which that can be done. And indeed, even as I think about doing it in the institution where I am, it's in advice that I can give to any other institution where they're intending on having women in leadership. So, of course, there are institutional policies, and institutional policies that encourage women to lead must be in place. Through career progression, through the human resource instruments, there must be a concerted effort to ensure that women have a space in that institution. Therefore, providing an environment in which women can comfortably lead. And that goes back to what I was saying, that leadership for women is different. There are different aspects and things that they have to juggle, and yet we can create a balance and make sure that the environment encourages them to stay in place. Now, moving on to the women themselves, there is also a lot of capacity building that needs to be done. And it doesn't have to cost. I know immediately we speak capacity building, it's always the query of how much is it going to cost? There are certain endeavors which can be done within the institution. And that one major one is mentoring. And mentoring from within the institution or without the institution. And within that mentoring can be both from women who who are aspiring to leadership can look up to, women who can mentor them, but in the same way from mentored by men, because we must build male allies. In this leadership journey for women, it's not going to be just about women. We have to have men who understand what the challenges are and are willing to mentor the women, as well as other women lifting up fellow women. The second idea is really around coaching. And again, so for those women who have moved on to a management level, to another level, the coaching experience is a great way of bringing out the best and, helping women achieve their highest potential in leadership or whatever else they are doing. Of course, that has cost implications. Most coaches are not for free, but the value that coaching experience would bring to that woman and what she would bring to the table in leadership in that institution cannot even be measured, really. And then finally, there's of course training. Part of the issues that we have discovered and within my project as well was that there are several areas that women feel they are perhaps not very adept at, and trainings which encourage building courage, confidence, public speaking, presentation, and many of these actually can be budgeted into HR budgets for training. So in terms of those efforts around changing institutions, in creating a suitable environment for women to lead, I think even just those three simple measures are good enough to transform the women in the organization and bring them to the table to lead. In public sector organizations, we are very lucky. We have gender equity policy, and all public sector organizations are encouraged in terms of their performance contract that they have to gender mainstream. So already there are even policies at a higher level which just need to be translated into the organization. So that's sort of an imperative in public sector organizations, but can very well be translated into private sector organizations. So the WomenLift Health Leadership Journey has also provided different opportunities for me. 2 months ago, I had the opportunity to participate in the G20 Raisina Dialogues. These are global dialogue forum, and this was happening in New Delhi, India. In there, I made beautiful connections with a whole lot of other leaders, not just in the health sector space, because again, we're talking about the intersectionality of our leadership journey. And subsequent to that, I have just received an invitation from the Kigali Dialogue Forums. They would like me to also sit there and present. In this same week as well, through linkages of people I've met in there, I have been invited actually tomorrow to speak in an Africa series for Cornell universities about science and policy making. So the opportunities actually begin to grow. And I think that's part of what this journey is, the connections we make, the opportunities that come out, and then the confidence that we build within the program itself. That authentic self that we realize who we are and what potential we want to achieve, I think just opens our eyes to the millions of opportunities out there. The world is there for our taking. The opportunities for women to lead are so many, and you just need to step up and step into that space. Step into that space half ready, a quarter ready, a third ready. Just step into the space, because the support for you once you're in the space is enormous. From women around you, from men around you, the opportunity to mentor you, to coach you, programs like this that just build and get you to understand yourself. There is so much. But I think the first step is step into the space. My favorite food is matoke and groundnut sauce. It has been all my life.